No oil. Now let's do this. Here's where the rubber hits the road. This is science. I'm going to show you some angiograms of disease reversal. And these were all reviewed in triplicate in the Cleveland Clinic core laboratory by senior technicians who do this all day long for national medical trials. So when I give you a certain percent of reversal, I know it's right. This first one you're looking at is the widowmaker, the left anterior descending coronary artery, and a 67-year-old retired pediatrician. And if you compare the diameter at the left with the diameter on the right is 10% larger. This is a lot easier to see in this circumflex artery that goes to the back of the heart, where you're in this 58-year-old factory worker. And this was described, this was described as a 20% improvement from here to here. And in this retired 54-year-old security guard, the right coronary artery, this was described as a 30% improvement from here to here. Now this, on the other hand, is a surgical colleague, a friend of mine, Joe Crow. Joe replaced me as chairman of the breast cancer task force. In 1996, Joe, with a cholesterol of 156, began to get chest pain. No family history, exercised regularly. He did not have high blood pressure. He was not diabetic. He was not a smoker. Chest pain. Cardiology in October of 1996 worked him up. And what did they find? Nothing. So a month later, the third week in November, he finished his surgical schedule, sat down to write post-operative orders. And suddenly, the elephant was on his chest, pain in his jaw, shoulder, arm. He was having a heart attack. He was whipped down to the cath lab. They start the catheterization, cardiac arrest, resuscitate, finish the catheterization, one more cardiac arrest, resuscitate. He stabilizes, and 3 days later, he's discharged from the hospital, but he's very depressed. Why is he depressed? Because at the time of his angiogram, what they found was that of the widowmaker, the lower 1/3 was all moth-eaten and diseased over too long a segment. You can't just pound in stent after stent. And it was too far down the artery to qualify for bypass surgery. So he was discouraged that he didn't think they could do anything for him. So 2 weeks after his heart attack, Ann and I had Joe and his wife out for supper. Joe, come on. You've been eating this absolutely hideous Western American diet. You've got the typical disease. We've got 10 years of data. Why don't you think about going plant-based? Okay, yes. They couldn't do anything else for me. I'll give it a shot. But I'm not taking any of those statin drugs. I don't trust them. Too many side effects. Fine. Your call. No problem. He became the absolute personification of commitment to whole food, plant-based nutrition. And over the next 2.5 years, total cholesterol plummeted. His LDL went from 98 to 38. And then in 2.5 years, he had another angiogram. Now, in the surgical office areas, our doors are 3 doors apart. So at noontime, on the day that I knew earlier that morning Joe had had his follow-up angiogram, I walked over, let myself in his office. There he was, sitting behind the chair. Joe, understand you had the old follow-up angiogram earlier this morning. Mind sharing with me? How did it go? He got up from his chair, walked around his desk, put his arms around me, some of these. I said, I think we're doing okay. And so I said, would there be any chance that I could see okay? And he said, yeah. Now, one thing here that's important. Yeah, this was very, very exciting for us. And this isn't going to happen to everybody. But when you have a young patient where the plaque is young, and the plaque is made up of fat, cholesterol, and inflammation, you can get these kind of dramatic reversals. However, this may be obtained to maybe somewhere between 25 and 35% of patients. What about those other 75% or 70%, where they're in their 50s, late 50s and 60s and older? They've had the plaque for decades. It's made up of fibrosis and scar and calcification. It's not going to go away. And yet, it's going to be my job today to show you exactly how it is that those persons just as well can get back to full activity of daily living without restriction. So that will be important. Now, despite my sparkling personality, of those original 24, there were 6 nice guys. But boy, I knew in the first month, they just didn't get it. I had no money for this study. So I returned them after the first month full-time to their expert cardiologists. And they became what I call a sort of a quasi-control group. And over the next 13 years, or 12 years, in the hands of expert cardiologists, those 6, 2 died, and the other 4 had to have bypass surgery. On the other hand, what about those 18 that stayed with our study for those 12 years? I wanted to know how many cardiac events of worsening disease they had experienced in the 8 years prior to coming into our study while they were in the hands of expert cardiologists. And here you see 49 events of worsening disease categorized that you see here on this slide. However, once they came into our study, over the next 12 years, 17 of those 18 had no further events. Yeah, we did have one little sheep at 6 years who wandered from the flock, got into the French fries, lamb chops, glazed donuts, more angina, had a bypass, but now he's back with the flock, but proves the point that I'm trying to share with you today. All right. Now, I was terribly, terribly excited about the results that we were getting. But new information, as Dean Ornish found as well, is not always received with open arms. We got absolutely hammered. Dr. Esselstyn, who do you think is going to follow that diet? That diet is too strict, severe, extreme. You know, now wait a minute. I love it when somebody asks that question. If you were to take our diet to Okinawa, the first thing they'd say, well, Jiminy Christmas, you guys have finally caught on. How long did it take you to do this?